Radiculopathy is a term that indicates the involvement of a nerve root. The nerve root is the first segment of a nerve as it exits from the spine. The most common cause of radiculopathy is disc bulging or disc herniation, where the extruded disc material causes a direct compression of the nerve root. The symptoms caused by disc herniation or compression of the nerve are usually pain that is frequently described as a shooting pain or electric shock type of pain in the distribution of the nerve, and this can affect the arm or the leg depending on the level of the disc protrusion. The pain is accompanied by sensory changes, and these are most frequently in the form of paresthesias, meaning pins and needles type of sensation, or numbness, again in the distribution of the nerve. The first test that is usually required to investigate a radiculopathy is an MRI, magnetic resonance imaging of the spine. And this, depending on which segment of the spine is involved, this can involve usually an MRI of the cervical spine or of the lumbar spine. If the MRI doesn't really answer the question of radiculopathy, doesn't fit with the symptoms reported by the patient, another test that can be asked and requested by your specialist is a nerve conduction study. And this is to look at the function of the nerves and see whether there is a different type of pathology affecting the nerves that could be, for example, peripheral nerve compression or an inflammatory disease. Especially in the context of a compressive radiculopathy, as you were saying, the most common cause is a disc protrusion. The first treatment is non-surgical, and this is usually made by a combination of pain therapy and physical therapy. The pain therapy is done with the painkillers, and again, usually the first line of treatment is the common pain relief or over-the-counter medications. A second level of therapy that is usually prescribed by a specialist is with neuropathic agents such as gabapentin, pregabalin, or amitriptyline. And these are all acting on specific neuropathy. The second non-surgical treatment is physical therapy, and this is usually physiotherapy. This can be very effective and very helpful to patients with spine disease, as it can improve their mobility and the core muscle of the spine. So when a specialist input is required and the non-surgical management fails, there are different options that are available. One option that is performed by us neurosurgeon is a nerve root injection. This is a minimally invasive procedure done as a day case, where a mix of steroids and a local anesthetic is injected around the nerve root under X-ray guidance. The advantage is that it is performed as a day case with minimal risk and non-invasive. Unfortunately, nerve root injections do not always work, as some patients do not respond, or sometimes the effect and benefit of a nerve root injection is limited over time. If everything fails, including the non-surgical management that we mentioned before, and or a nerve root injection, then surgery is usually the answer. Surgery is performed in case of a discectomy, with the aim of removing the disc bulging, thus relieving directly the compression on the nerve root. There are several approaches that can be discussed, and you can go through them with your specialist, from the traditional operation to more minimally invasive options, but they're all usually equally good in relieving the pain and the compression of the nerve. with an acceptable risk profile. So after surgery, physiotherapy can play again an important role in the physical rehabilitation and in the recovery from surgery, as again it can improve the mobility of patients, speed their recovery, and strengthen their muscle. The lifestyle modifications, there are a few things that can help patients in minimizing the risk of having additional problem or later problems related to the spine. It is important to have a healthy diet, not to be overweight or obese, doing regular sport exercise, and here some sports like swimming are particularly good with patients that have a spinal problem. Finally, smoking is contraindicated or can have also side effects in spine, and it's not good if patients need surgery.